Hi guys, this is Dee. I have an idea for a video I'm going to do today, but it's a little bit different than the other ones I've done. This one's going to be for people in the healthcare field, mostly nurses, for our new nurses right now, our new grads that are probably starting their first nursing jobs like anytime now. For younger nurses or less experienced nurses who are having a little bit of a struggle with putting in IVs, getting blood using a butterfly needle. So these are the two things that sometimes could be super tricky, and if you're a new nurse, it's like terrifying. It's totally terrifying because you feel like an idiot if you can't do it. So there's things you learn along the way, and the weird thing is that it's such a big part of what we do with every single patient, but it's not something that's taught in nursing school, which is very strange. But you learn it when you start your job. So I'm going to go kind of through what I learned myself, just going through the learning process, and share it with you guys, and hopefully it'll help a little bit. So I'll start with this. So first of all, your problems you're going to have with inserting an IV are going to be patients that have like rolling veins. You'll see them, their veins like will roll around when you try to pull on it. They'll like move, and you'll actually insert the IV and the vein will like move to the other side, and you put the needle in, the vein goes back like that. Like, it's really awful. There is occasions when the needle goes through one side of the vein and out the other, so you think you're not getting blood and you can't figure out why, or you're just not, or that doesn't happen, but for some reason you're still not getting blood. There are ways around these things that happening, and there's ways to minimize the chances of these things happening and getting in the way of you being able to do your blood draw or insert your IV. So first thing I'll do, let me think here. First I'll do inserting the IV. It's the trickier one. Okay. So, and you know what? It's pretty much going to be the same for the butterfly. So here's your IV. This is a 20 gauge IV. I just opened it out of the package. It was like brand new and sterile. 20 gauge is what you're basically going to use. They're always pink unless it's a child, then you'll use a 22, and they're usually yellow. So what you're going to do is you'll pull your cap off, and, well, first you're going to tie your blue elastic around your patient's arm to get the blood flowing. You're going to pull your cap off your IV, and it's got little wings here for you to hold it. You can hold it like that. You don't want to hit that because that's going to pull the needle back inside the shaft, and it's a way to protect us from getting needle stick injuries. So, but you don't want that to do that while you're giving an IV. Imagine you just hit the vein and then you hit the button and the needle pulls out, and now you've got to poke this poor patient again. Like, it doesn't go over well. So anyways, you're going to hold it like this, or however you're most comfortable holding it. And you'll put your finger down, and you're going to hold. I always go for the forearm. A lot of nurses will go here because it's easiest. It's the biggest vein. Some of them will do the hand. That hands can be pretty easy because they're shallow. I always do the arm because I feel like I always can find a good vein on the arm, but I do the arm because they can bend their arm then. They don't have to worry about not being able to bend it when the IV is here, and they can also are free to wash their hands because their hands don't have an IV in it. So that's why I always go for the forearm first. If I poke the forearm and I can't get the vein no matter what, then I'll move somewhere else, usually up. But usually there's not a problem getting the forearm. But you're going to go at first to wherever you can get the best vein. And it's not always going to be the one that looks the best. It's going to be the one that feels the best. And what you're feeling for when you're feeling for a good vein is one that's bouncy. If it feels like it's bouncy a little bit, and you can feel like the whole thing is bouncy, then that's a good vein. That's a vein that's full of blood, and it's a vein that you're gonna be able to get some blood from. And you want it to be at least an inch long. So see that vein right there? I'm very veiny, so this is actually quite good. That would be a great vein for an IV. And if I were doing the IV, I would start right there. I would insert the needle right there, because you're going to push the needle up into there, and that's about how far it goes inside. Then pull the needle out, and only the soft catheter is remaining, and I'll show you how that works. So here's your needle, Here's your patient. I've got their arm tied up. Now I'm about to put in the IV. So I'm gonna hold the arm. I insert the IV needle. As soon as I see a flashback of blood, and you'll see blood flash back into this section here, the clear section. As soon as I see blood coming back up through that needle, it means I've hit the vein. All is good. I'm gonna, with my other hand, untie the blue elastic band off their wrist, and I'm going to fill the catheter in. So this is a trick. They teach you when you learn to do it with two hands like this. But I find it really hard to do it with two hands. It's hard. It's not very good. Like, my dexterity isn't good, and that is for a lot of people. The best way to do it is to have nails. So there's a ledge here for if you have a fingernail. If you have a fingernail, you can just push your catheter up like that, and that's what's going to stay in your patient's arm. That soft little catheter, like that. And you've pulled this out. And at that point, you press a button, your needle's gone. That's it. It can't be used again. You throw that in your sharps container. This is the soft catheter that is remaining in your patient's arm, and you're going to tape it down however the place you're working wants you to tape it. Usually I do a figure 8 and then tape it in two places, top and bottom. But that's how that works. Now, troubleshooting. This is the big one. So if you've got someone with rolling veins, what I have found is the best way to avoid problems with that is to hold them underneath and pull tight like that. Pull it really, really tight so that that vein can't move. I'm squeezing this arm very, very hard. If it's their hand, I'm going to squeeze it very, very tight. There's another good vein right there, you see? That's a really good one. So I'm going to, if that's a rolling vein, I'm going to squeeze it really, really tight so it can't really roll because I'm squeezing so tight. That's one trick. The other thing is, if you're not getting blood, the needle's in but you're not getting blood, try pulling the needle back a little tiny bit, because sometimes your needle will actually go in one side of the vein and go right through and out the other, and that's why you're not getting any blood. So if you pull back a little bit, sometimes you'll start getting your flashback of blood, and then you're like, okay, yeah, I went through, which it's not dangerous, it's not harmful to the patient, it's not a big deal. It happens. So, and that's the same with the butterfly and taking blood. The other thing I do, and I've never seen another nurse do it, but I do it all the time, and it works for people who just, I can't get the blood out of them. For some reason, their veins aren't great, the blood isn't flowing. I will get them to hang their arm lower than their heart, as low as possible, like over the edge of the bed or over the edge of the chair, and let it hang for a good 3 or 4 minutes. So all the blood rushes to their hands and rushes. Look how prominent my veins are in my hand right now, because just hanging it down for that second. So the veins are much more prominent. And every single time I've had to use that method, it has worked, and it's worked on my first poke. So if I've assessed the person, I know I'm going to have a hard time getting blood. They've got tiny veins, they've got thin veins, veins that break, have a history of breaking. Then that's going to be a good candidate to let them hang their arm. You could also use warm towels, that sort of stuff, but I find hanging the arm just the best. The other thing that happens sometimes is the venal collapse, and often that happens is if you're using a catheter that's too small. So sometimes nurses, especially new ones, will use a 22, a yellow one, which is for babies, on an adult, just because it's so tiny, and they feel like the smaller the needle, the easier it will be to get the vein. But that's not the case. The bigger the needle, the needle's got to be the appropriate size for the vein you're trying to get. And the 20 for an adult is going to be your go-to. But if you're using a 22 and your veins are collapsing, then go up to a 20, and or go down to a 20, and you'll have a thicker gauge needle, but you'll see that the vein is much less likely to break and blow on you, and you're going to get your blood. With butterflies, the same trick would be for if you can't get blood. The other thing you can do with IVs, both IVs and butterflies, is you can, let's say you're holding it and your blood is coming, and you're trying to get a blood sample before you screw in your intravenous and your IV, like tubing into the IV. You're getting blood first out of that. Tip it, just try tip, like you go in on an angle, right? Always towards the heart, so let's show you that way. Try tipping it up a little. Just give your butterfly or your needle, your IV needle, just a little tip up. I don't know why it works, but it works like 90% of the time. If you're not getting blood, you're in there, you felt the pop. When you hit the vein, you'll feel it. You feel the pop through the IV. You feel it pop and go in because, again, it is bouncy. It's like a thin capsule filled with fluid. So you'll feel it pop and go in. You know you made the vein. You know you're there, but blood's not coming. Try just lifting a little bit, and see if that happens, if that helps. If not, maybe just pull back a little. And that should, if you do those two things, that should clear up your problem and your blood should start to flow. So that is pretty much it. The only thing I can say is always have all your supplies ready at the bedside, right on the bed, ready to go. Make sure you have your tape ripped at first when you first start doing this, because you count how much tape you need and get it all ready, because when you're nervous and you're scared, you need that stuff to be there, because it's not second nature yet, and you'll be nervous and you'll forget. You'll get flustered and shaky and all these things. And so you want to have all your stuff by the bedside. The other thing I want to advise you is that if you're really, really scared and you're shaking and that, just tell your patient, I'm really sorry. I know I'm shaky. I'm really nervous. Like, you don't necessarily have to say, this is my first time. You could say, I'm a new nurse and I'm still nervous with this skill. So that's not a big deal. Most people are super understanding. They understand that everyone's got to learn. Everyone's got to start somewhere. And a lot of times they'll be more patient with you if they know that you're a learner. So don't be afraid to let them know that. It doesn't make you any less of a competent nurse. Like, the best nurses ask questions. The best nurses know what they don't know. And that's pretty much a rule throughout nursing. That's how it goes. So it's the same in this situation. So I hope that is sufficient. I hope that was helpful. I'm trying to think if there's anything else, and I can't. But if I do, I'll come up and I'll pop it in and do a little add-on to this video. But I think that's it. And yeah, good luck, everybody. And for the new grads that are starting your first jobs, good luck. You're going to love it. It's so much fun and so exciting. And 12-hour shifts suck, but, you know, it's well worth it. You feel good at the end of the day. And you know you did a good job. So anyway, you take care, guys. And for anybody else who watched who isn't in nursing, congratulations and good for you, because I'm sure it's pretty boring if it's not your thing. So thank you for watching, and I will see you guys all soon. Take care and have a nice night.